What if I told you that your age might be influencing your medical care in ways you never imagined? The moment you walk into that examination room, certain assumptions might already be forming in your doctor's mind. These aren't necessarily malicious thoughts, but they're real, and they can impact everything from how seriously your symptoms are taken to which treatment options you're offered. Today, I'm going to share 5 uncomfortable truths about what many healthcare providers actually think when treating older patients. Some of these might surprise you, others might confirm what you've already suspected. But here's why this matters. Understanding these biases is your first step toward getting better care. So stick around until the end, because the last point I'll share could completely change how you prepare for your next doctor's visit. Let's start with the first truth. Many doctors automatically assume your problems are just part of getting older. Picture this. You walk into your doctor's office complaining about back pain, feeling more tired than usual, or having trouble sleeping. Instead of investigating these symptoms thoroughly, you might hear something like, "Well, these things happen as we age." While it's true that our bodies change over time, this knee-jerk response can be dangerous. That persistent back pain might not be from sleeping wrong. It could be a compression fracture that needs immediate attention. The fatigue you're experiencing might not be about slowing down. It could be anemia, thyroid problems, or even early heart disease. I remember talking to a woman named Margaret who was 76 when she started feeling dizzy and weak. Her first doctor told her it was normal for someone her age and suggested she just be more careful when standing up. Margaret wasn't satisfied with this answer, so she got a second opinion. It turns out she had dangerously low blood pressure from a medication interaction. Once they adjusted her prescriptions, she felt like herself again. The scary part is, if she had accepted that first explanation, she might have fallen and seriously injured herself. This happens because doctors often work under intense time pressure. When they see an older patient with common complaints, it's easy to default to age as the explanation. But age alone rarely explains sudden changes in how you feel. A good doctor should ask when symptoms started, how they've progressed, and what makes them better or worse. If you feel like your concerns are being brushed off as normal aging, don't be afraid to push back. Ask your doctor to explain specifically why they think age is the only factor, and request tests if you're not convinced. The second truth might sting a little, but it's important you know about it. Some doctors believe older patients won't stick to treatment plans. This assumption can lead them to oversimplify your care or avoid recommending treatments they think you'll find too complicated. They might be thinking, if I explain all these medication times, they'll get confused. Or, this physical therapy routine might be too much for them to remember. While some older adults do face challenges with memory or mobility, many others are perfectly capable of managing complex treatment plans. This bias can rob you of better treatment options. Maybe there's a combination of medications that would work better than the single pill you're currently taking. Perhaps there's a physical therapy program that could dramatically improve your mobility, but your doctor assumes you won't want to commit to it. Or maybe there's a newer treatment option that requires more monitoring, but could give you significantly better results. I knew a man named Frank who was dealing with diabetes. His first doctor gave him a very basic management plan, assuming that anything more detailed would be overwhelming. But Frank was a retired engineer who wanted to understand everything about his condition. When he switched to a new doctor, she took the time to explain different insulin options, continuous glucose monitoring, and how various foods affected his blood sugar. With this comprehensive approach, Frank was able to control his diabetes much better than before. The key here is to show your healthcare team that you're engaged and ready to be an active participant in your care. Bring a notebook to appointments, ask questions, and don't hesitate to request written instructions. When doctors see that you're committed and capable, they're more likely to offer you all available options. If you're finding this information helpful so far, please leave a comment with the number 2 to let me know you're still with me. And if you haven't already, consider subscribing and hitting the notification bell so you don't miss any of our upcoming videos. Your support really helps us continue creating content that can make a difference in your healthcare experience. Now, let's talk about the third truth, which is perhaps the most troubling. In some situations, doctors may unconsciously prioritize younger patients. This doesn't mean they're intentionally providing worse care to older adults, but when time and resources are limited, they might instinctively spend more time with younger patients. The thinking often goes like this. Younger patients have more years ahead of them, so interventions might have a bigger impact. But this logic is flawed for several reasons. First, it assumes that quality of life doesn't matter as much for older adults. A 75-year-old who gets effective treatment for arthritis might enjoy 10 more years of gardening, traveling, and playing with grandchildren. That's incredibly valuable. Second, many older adults are healthier and more active than ever before. Age alone doesn't predict how someone will respond to treatment. This bias can show up in different ways. Maybe diagnostic tests are ordered less quickly for older patients with certain symptoms. Perhaps surgical options aren't discussed because the doctor assumes recovery would be too difficult. Sometimes it's as simple as spending less time listening to concerns because there's an assumption that complex problems come with age and can't be fully solved. I remember hearing about a woman named Dorothy who was 78 when she developed severe shoulder pain. Her first orthopedic surgeon basically told her to learn to live with it, suggesting that surgery at her age wasn't worth the risk. Dorothy wasn't ready to give up her independence, so she got a second opinion. The new surgeon evaluated her overall health, not just her age, and determined she was an excellent candidate for shoulder replacement. The surgery was successful, and Dorothy returned to many activities she thought she'd lost forever. The important thing to remember is that chronological age is just one piece of your health puzzle. Your overall fitness, mental sharpness, support system, and personal goals should all factor into medical decisions. If you feel like your age is being used against you, speak up. Ask your doctor to explain their reasoning and whether there are other options to consider. Sometimes a second opinion can reveal possibilities your first doctor overlooked. The fourth truth touches on something that can be particularly frustrating. Many doctors underestimate what older patients want out of life. There's often an assumption that once you reach a certain age, your goals become limited to basic comfort and maintenance rather than pursuing meaningful activities or new experiences. This mindset can influence the type of care you receive in subtle but important ways. For example, if you mention joint pain during a routine visit, your doctor might focus only on pain management rather than discussing treatments that could restore your mobility for activities you love. They might think, at their age, they probably just want to be comfortable at home, instead of considering that you might want to keep hiking, dancing, or traveling. This assumption can lead to less aggressive treatment plans that don't align with your actual goals and desires. I once spoke with a gentleman named Arthur, who was 82 and passionate about woodworking. He developed tremors in his hands that were affecting his ability to do detailed work. His first neurologist focused mainly on general tremor management. But when Arthur explained how important woodworking was to him, they developed a more targeted treatment plan. With the right combination of medication and occupational therapy, Arthur was able to continue creating beautiful pieces well into his late 80s. The lesson here is that your personal goals and interests matter enormously, regardless of your age. If staying active is important to you, Make sure your doctor knows that. If you have travel plans, hobby commitments, or family activities you want to participate in, share that information. When healthcare providers understand what matters most to you, they can tailor treatments to support those goals rather than just addressing symptoms in isolation. Don't assume your doctor knows what you value most. Be specific about what you hope to achieve and ask how different treatment options might support those objectives. This conversation can transform your care from generic management to personalized treatment that enhances your quality of life. If you're still following along and finding these insights valuable, please comment with the number 4 below. Your engagement helps us know this content is useful and motivates us to keep creating videos that can help improve your healthcare experiences. Now, let's discuss the fifth and final truth, which is often the most overlooked aspect of healthcare for older adults. Many doctors underestimate how much emotional and mental well-being affects physical health in older patients. While they're excellent at treating blood pressure, joint problems, and other physical conditions, they might miss the significant impact that loneliness, grief, anxiety, or depression can have on overall health. Aging often brings major life changes. Losing a spouse, friends moving away, retirement adjusting to physical limitations, or dealing with the reality of mortality. These emotional challenges don't just affect mood, they can impact sleep, appetite, immune function, and even how well your body responds to medical treatments. Yet many doctors don't routinely ask about these aspects of your life because they're not part of standard medical training or typical appointment protocols. Sometimes what looks like a purely physical problem has emotional roots. That persistent fatigue might be related to depression following a major loss. Sleep problems might stem from anxiety about health concerns. Even things like frequent infections or slow healing can be connected to stress and emotional well-being. When doctors focus only on physical symptoms, they might miss important pieces of the puzzle. I remember talking to a woman named Helen whose health seemed to decline rapidly after her husband passed away. She was seeing multiple specialists for various symptoms, but none of them asked about how she was coping with her loss. It wasn't until a friend suggested she talk to a counselor that things began to improve. Once Helen had support for processing her grief, her physical symptoms became much more manageable. It turned out that her body was reflecting the emotional pain she was carrying. This is why it's so important to give your healthcare team the complete picture. Don't hesitate to mention if you're feeling lonely, stressed, worried, or sad, even if it seems unrelated to your physical symptoms. A good doctor will understand that mental and emotional health are deeply connected to physical well-being. Sometimes addressing the emotional component can lead to improvements in physical symptoms that medications alone couldn't achieve. If your current healthcare providers don't seem interested in these aspects of your health, consider asking for referrals to counselors, social workers, or support groups. Taking care of your emotional well-being isn't a luxury. It's an essential part of maintaining good health as you age. So there you have it. 5 uncomfortable truths about what many doctors think when treating older patients. I know some of these insights might feel discouraging or even upsetting. You might be thinking about times when you felt dismissed or rushed through appointments, but I want you to remember something important. Knowledge is power. Understanding these potential biases puts you in a much stronger position to advocate for yourself and get the quality care you deserve. You are not just your age on a chart. You're a complex individual with a lifetime of experiences, clear goals for your future, and health needs that deserve careful attention. Every symptom you experience, every concern you have, and every goal you want to achieve matters just as much now as it did when you were younger. Don't let anyone convince you otherwise. The next time you walk into a medical appointment, remember that you have the right to be heard, to ask questions, and to expect thorough care. If you feel rushed or dismissed, speak up. If a doctor attributes everything to your age without investigation, ask for specific explanations. If treatment recommendations don't align with your goals, discuss alternatives. And if you're not satisfied with the care you're receiving, don't hesitate to seek a second opinion. Building a good relationship with your healthcare team is like any other relationship. It requires communication, mutual respect, and sometimes a bit of patience. When you approach your medical care as an informed, engaged partner rather than a passive patient, you're much more likely to receive the attention and respect you deserve. Remember, aging is not a disease that needs to be managed. It's a natural part of life that comes with both challenges and wisdom. The right healthcare providers will see you as a whole person, not just a collection of age-related issues. They'll listen to your concerns, respect your goals, and work with you to maintain not just your health, but your independence, dignity, and quality of life. Thank you so much for watching today's video. I hope these insights will help you feel more confident and prepared for your healthcare interactions. I'd love to hear from you in the comments below. Share one thing you learned today that you plan to put into practice, or tell us about a time when you felt these biases affected your care. Your experiences and insights help create a community where we can all learn from each other. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and share it with anyone who might benefit from this information. Your support helps us continue creating content that can make a real difference in people's lives. We have more videos coming that dive deep into healthcare advocacy, aging gracefully, and getting the most out of your medical appointments, so make sure you're subscribed with notifications turned on. Thanks again for joining us, and I'll see you in the next video.